Professional IGP, today from Institute of Global Professional IGP. Thank you all for joining us and listening with us today. Honorable Knowledge Seeker, today I am your host for the evening. My name is Pakunga. I am from Bangladesh. Knowledge Seeker. I am proud to be associated with IGP. IGP Social and Asset Maintenance Education and Training Institute. In last year, we already served 35 million plus knowledge seeker from 100 plus countries. IGP is internationally recognized and globally accredited. We are connected to more than 450 plus professions and 4,500 plus organizations. Institute of Global Professional is an education and that provides social work globally recognized and reputable. Research and community research providing holistic social work and education. We believe that it's not a 50 is one is just background formal education. So we provide effective training and consultation to generate professional generation all over the world. We distribute our services locally, national, international to student job seeker, job holder, and also for learners the respective campus location and distance learning platform. We are an occupational and dependable institute. RGP is one of the famous online institute from all over the world. Our vision is education is for business friendly, it's a part of our human rights. Based on our vision, we are trying to reach all corners of the world for free webinars, seminar courses, our quiz competition, mentoring, and counseling, etc. On the other side, we are also trying to offer more than 100 real services for free, like our own portfolio website, resume builder, cover letter, motivation letter, and one knowledge platform for gather and journal, which you can update all day. Teach learning game, website, free course, conversations, and many more. We help to empower you to learn to meet their expectation and dream and become highly skilled people. We implement our training program, webinar, and offline online courses for yoga learner, the professional today speaker, and coaches. Our session are conducted by global junior professional to develop our kind of and promote the education of developers and persons. Screen knowledge is crucial for the street of global professional. We believe the knowledge is level, light, and vision. So, it try to listen to the generation and we start the move to research and practice method. We must have a genuine concern for the learner represent more diversity, growth, and innovation are required to lead a session with professional passion and integrity. As a member of complete offering effective customer service and confident improvement so that individual who seek information can improve their skill level and value. Before I move to the next, let me remind you of the share tag and mention it in the comment box. The support is very valuable for us. Thank you. Before we move to the next, let me remind you of the share tag and mention it in the comment box. The support is very valuable for us. Thank you. Dear IGP speaker, participant and well-wisher, at this moment is a very important message for you all. We change and design our website www.edioigp.com. On this website we serve best for everyone. Hope it will be benefited. We already launched our new website where you can find all our previous activities together with lots of new features. But one strong point is that without an account or login, you cannot enjoy our service. So create an account for once with proper information. Note that with proper information, you will enjoy a feature. With this method, you cannot do anything here. From now on, you have to participate in this competition on our website. We request that to join directly on our website. Now I can check all of our previous webinars with verified certificate. Now, is there a time only? Because after the session, we will not provide any course or certification. You have to take part in one exam. For that, if you pass, you will receive your certificate, otherwise not. But you can take part in an exam unlimited till you pass. If you are an IGP speaker, you can download all your previous certificate, explication certificate. If you are a host of IGP, you can download certificate of gratitude. If you are an online like this competition winner, you can download a certificate of participation. If you are selected for a lifetime membership, then you can download a certificate of lifetime membership easily. Besides this, if you participate in any award function which organized combined support with IGP, you can download that also. You can still prepare and download 18 times certificate from our website within a minute. Certificate of Global Professional Membership, Certificate of Global Inclusive Academic, Certificate of Active Knowledge Seeker, Certificate of Social Activity in Academic, Certificate of Achievement IGP Knowledge Seeker 2020, 2021, and 2022, Certificate of Participation Webinar Series 1, Authentic Assessment in Teaching Learning, Certificate of Participation Webinar Series 2, Teaching with Foreign Language and Assessment, Certificate of Participation Webinar Series 3, Digital Classroom Engagement 2, Certificate of Participation Webinar Series for the New Trend in Education, Certificate of Participation Webinar Series 5, Artificial Leadership and Management Skills, Certificate of Participation Webinar Series 6, Trend and Innovation in Mathematics Education, Certificate of Participation Webinar Series 7, Research Comprehension Approach, Certificate of Participation Webinar Series 8, Art in Teaching a Special Program in the Arts, Certificate of Participation Webinar Series 9, 21st Century Tooling Teaching Mathematics, Certificate of IGP Corporate Ambassador, Certificate of IGP Campus Ambassador, which you can prepare and download within minutes. From now on, you can participate in 1,000 plus international level to verify this certificate. Teaching tips for teacher, health is for parents, health is for teens, education tools for teacher. You can join IGP alumni. You can check out our 50 experience services website for free and many more. Dear IGP well-wisher, we promised previously, but lack of technical problem in late sending on time. This is a great opportunity to collect reference condition. We solve solution from our website. Now I can enter reset password everything and check it for all other data. It's a total request to check our button pages on our website. She like us will benefited. Thank you, but note that Without an account of login, you cannot enjoy a subset. At present, we are going to start our 2429 webinar, which name is Vaccination, a small dose, big protection. And today our speaker's name is Dr. Sunil Malhar Kulkhani. He is from India. Before I hand over this to our speaker, sir, I'll share a little bit about him. Associate Professor BVDU, College of Nursing, Sangre. Now, very important moment for me to invite our speaker to IGP with his presentation. Now, very important moment for me to invite our speaker to IGP with his presentation. Hello, sir. Good evening.
Hello, good evening, ma'am. Can you hear me?
Yes, sir. I can hear you. So, the stage is you. You can start your presentation now.
Okay. My slide is visible to you, ma'am.
Yes, sir. Yes, sir. Your slide is visible.
Okay, ma'am. Thank you. Okay. Good afternoon, good evening, and good morning because various members from the various country they are joining. Today again we are discussing a very important topic. The title is vaccination, small dose, big protection. Vaccination, small dose, big protection. Only 5 to 6 points we are going to discuss in short. So you will get its importance and you will go further about each and every aspect of that to get it benefits. So we are discussing vaccination, meaning, definition, types, importance of the vaccination. Vaccination to the various members for children, adolescent, adult, old age and special group members, what vaccines are given. Vaccination, the process, what are the some minor side effects are there, what is the treatment for that, and in which cases we are not giving certain vaccination. There are challenges occurs in this process and what action to take to minimize the challenges or to solve the challenges, and what will be the future vaccination. World Immunization Week, we are celebrating 24 to 30 April each year. And this year's the theme is humanly possible immunization for all. So every human should get the immunization. Then we are preventing so many diseases and we are getting benefits of prevention of the diseases and consent to that. These points are going to discuss later on. Before starting, we must know certain terms like immunity. Immunity means our resistance power to the against the disease. This immunity may be general, prevent the various diseases or some specific diseases. Second term is immunization. Immunization is the development of immunity to a disease as a result of vaccinations. For example, we are receiving the BCG vaccination, we are getting immunity for prevention of tuberculosis. Third, antigen. Antigen, it is a substance or disease causative agent or their products. It may be part of the disease agent, microbes, or it may be its secretions, toxins are there. Then vaccines, these are the antigen or antibodies used to get the immunity. Antibodies, these are the protein materials formed by the body against antigen. Antigen, these are the foreign materials are there, microbes are there. When they are entered in our body starts to get a fighting powers in the form of various proteins. These are called as antibodies. Vaccination, it is a process of giving the vaccination. So immunity, resistance power, immunization, process to get immune, antigen, these are the disease agents or its toxins or its certain parts of cell. Antibodies, these are the protein materials formed against the antigen. Vaccine, these are the antigen or antibodies used to get the immunity, and vaccination, the process of giving the vaccination. So what is the importance to give the vaccinations? There are few I have listed here. Later on there are some additional are there. Very important two major advantages are there, importances are there. First one, to protect from the serious diseases or severity of the diseases. For example, polio, when you are taking the vaccine, we will prevent the polio like serious diseases because we, it leads paralysis of the various body organs. Or if it is occurs by any other strain of the polio, its severity will be very less, will not become as a handicap. Disability will be not there. Second importance mainly to eradicate, eliminate and control the disease. To eradicate, eliminate and control the disease. Three important words are there. It starts from the control. Control means whatever the number of cases are there in particular areas, they are remaining in a limited numbers. Whereas eliminations, the number of cases in a particular area, these are the diseases will go down because of the vaccination up to minimum level. Up to minimum level. And eradication means total removing of the disease in a particular area or overall the world. The disease agent is only present in the laboratories because if it is occurs in future, we will have a microbes so we can prepare the vaccination again. So to eradicate, eliminate or control the disease. Third, to provide the cost effective public care. So when there is no disease, we are not having the disease caring structures. It may be hospitals, it may be staffing members, it may be education system, it may be uh, person those are becoming sick, they will lose the productive work because of the leaves or hospitalization. They are losing their economic way, family burden will increase because of the hospitalized. Everything will be prevented because of just vaccination. And last is to promote quality of the life. When we are free from the disease, when you are productive, you will live happily, you will work happily. So it promotes the quality of life. So protection serious diseases, severity of the diseases, to eradicate, eliminate and control of the diseases, to provide the cost effective public health care and to promote the quality life of individual. So why everyone has to take certain vaccines in the particular situations? There are about 10 reasons are there. First reason, vaccine preventable diseases have not gone away. So many diseases still they are there, infectious diseases as well as in future we are trying to prevent certain non-communicable diseases also. So all the communicable diseases are not gone. That means eradication is not there. That's why vaccination has to take. Second reason, vaccine helps to keep you healthy because it will not affect the disease. You will maintain your health and your development, body activity will be proper. Third, vaccines are as important to overall health as diet or exercise. So it protects from disease. So disease affects each and every aspect of life. It may be physical, mental, social, economical, all the aspects. If there is no disease, so that's why how you are taking the diet, exercise, rest, and all basic needs. Vaccination is also equally important for health. Fourth reason, vaccination can be mean the difference between the life and death. So just you have observed last 2 years there was corona, small virus. How many deaths were there? So you can imagine that what is the difference between taking the vaccination and prevention and deaths caused by the corona. Fifth reason is vaccines are safe. Vaccines are safe 100% because it is tested for its potency, means its functioning as well as its safetyness. With that measures they are provided. Sixth reason is vaccines can't give you disease. They are designed to prevent it. So mostly 100% they will prevent if any other stage because there are certain variations are there, different type of similar microbes are there. They may cause the disease, but its severity will be less. Or one type of even it will protect various types of the particular disease. Seventh reason is young and healthy people need the vaccination. because everyone needs the vaccination. Those are sick as well as those are healthy. Sick members they will recover first, whereas healthy they will not get the sick illness or disease. Eighth reasons, preventable diseases are expensive. Take the example of same corona small vaccine. It is mostly freely provided by the government, but the hospitalized care according to various countries it was 2 lakh to 4 lakh, and there was not surety of the life. So the vaccine preventive disease are very expensive. Ninth reason is when you get sick, your children, grandchildren, and parents may be at the risk. By both ways, when the head of the family get affected by the disease, whole family get disturbed. Or from that head of the family, other members will get the diseases. So ultimately, small vaccine taken by one person prevents disease to the whole or entire family members. And the last reason is everyone deserves to chance to stay healthy. It may be poor, it may be rich, or any part of the world. Everyone has to get the vaccine because it is their right. Everyone is deserved to remain healthy by taking specific measures by the individual as well as government. So these are the 10 reasons why we have to take the vaccination. So we have certain idea before the vaccination start. The immunity word. Immunity is power of resistance of the disease. We are getting resistance power by two ways. These are the specific ways are there. There are certain general ways are there. General ways like we are keeping healthy our body, keeping and happy. Second is specific ways to protect the various diseases. Especially we are considering here infectious diseases and few non-infectious diseases. So we are getting the immunity by two ways. One active way, second is a passive way. Again, active ways and passive ways we are getting from the nature and from some efforts. Nature means when we are exposing to the particular microbes, they will enter in our body and depends upon our health status of the body, we get the immunity. That is called as natural immunity. But when we are taking the vaccination, we are getting active acquired immunity. Why it is acquired? Because we have taken the vaccine and through our body changes, through our immune system, we have created the resistance power. That's why it is active as well as acquired. But when you are taking breastfeeding formula exposure to the particular disease, when it is in minor form or in subclinical cases, we are getting small dose of microbes and we are getting this. In some cases, this will given ready-made antibodies to our body when the disease cases are more or its severity is more. So it becomes as acquired when you are taking ready-made antibodies, and it is ready-made antibodies. That's why it is a passive. When we are getting from the breast milk or through the disease process, okay. So immunization, it is a procedure by which body is prepared to fight against specific diseases. So active, our immune system, our body takes effort to prepare the antibodies. Whereas passive, our body only receives the antibodies directly and we are getting resistance power. Our immune system does not make any efforts. How we are getting the immunity? We are getting the immunity. These are called as immunizing agents. Immunizing agents are there. There are three types of the agents are there. One, these are the various vaccines. These vaccines nothing but antigen or antibodies. Second, immunoglobulins. Immunoglobulins, these are the again passive ready-made antibodies prepared in someone else person or some other animals and we are receiving it. especially anti-sera. Third is there, we are getting these antibodies apart from the human members. Apart from the human members. Just one. So anti-seras are there. So vaccines mostly they are safe. Immunoglobulins and antiseras they are directly destroying the microorganisms, whereas vaccines they will prepare antibodies in our body. So vaccines, these are the compound modified and weaken the disease producing agents. Why we are not getting disease by the vaccine? Because these are the modified or they are weakened and their number is less. That's why we are not getting the diseases. Immunoglobulins, these are the proteins made by the plasma cells. These are types of white blood cells. There are five types of the immunoglobulins are there in our body. When we are exposing to the antigen or disease, we are preparing in it body. These are IgM, IgA, IgE, IgD, and IgG. Just keep in mind these are the ready-made antibodies are there in the human bodies. Third, serum. These are antibodies or antitoxins. They are prepared in animals. So the antigens are given to the animals and antibodies are taken and after certain process they are injected to our body to destroy the microbes or toxins. Along with the vaccines, when you are receiving the vaccines, the vaccine contains some other components. There are various components are there like adjuvants. Adjuvants means these are the solutions, these are the substance, those are increasing the immune response and decreasing the quantity and frequency of the vaccine. For example, some of the vaccines they are containing alum products are there or aluminum products are there to enhance the vaccine immune response, increase the immune response and decrease quantity of the vaccine as well as frequency of the vaccine. Second component is stabilizers to protect the integrity. Stabilize whatever the vaccines are there, they should remain at the same status. They should be remain at the same status. For example, they are using gelatin in certain vaccines. Third, preservatives are there. So microbes, they are there. So it must remain a weakened form. It will not cause a disease to maintain its weakened potency by adding certain microbial agent. Adding certain microbial agent, for example, thimerosal. So other microbes will not grow in the vaccine. The vaccine, which microbes are there, they will there. Like polio vaccine contain polio virus only. In manufacturing by the products, they are using little amount of the antibiotics, DNA products are there, some protein materials, formaldehyde materials remain vaccine active because vaccine is a produced in the industries, they are transported to the big storing areas, then to the hospital, to the clinics, then to the peripheral area. Last certain vaccines, they are in a powder form, so we are diluting it and they are providing. You might have seen like BCG vaccine, it is a dry powder adding the solution. So these other components are also equally important to produce resistance power. The vaccines, they are not formed all of the sudden. It occurs maybe in last 100 years. There was one by one research is going on, and they are finding out various type of vaccines. So they are said as the first generation, second, third generation, third generations, and fourth generations. Why? Because of their when it is identified or prepared and what modifications are done. So vaccines, there are various types of the vaccines are there, like attenuated live vaccines. Attenuated live vaccines means reduce the disease ability of particular microbes. For example, polio, typhoid, oral. So they are crushed, reduce their potency, but the microbes, they are alive. They are not completely dead. They are weakened. Second, inactivated or killed. The microbes are completely killed, but they have potency, very less potency is there to remain as a antigen. Antigen, it is like infectious agent. So our body forms antibodies against that, like typhoid, cholera, rabies, hepatitis A. So what main difference is there in killed vaccine or live vaccines? These live vaccines mainly we are taking single dose. Their immunity power is remaining long. They having great effectiveness is there, but it maintain needs proper temperature. Whereas killed vaccines, they having very less duration of activeness, but it will remain. The vaccine will remain long time. It needs multiple doses because within short time its working power may slightly reduce. So it needs multiple doses, maybe one, two, three, or booster doses. Then third is a toxides. We are using some micros. In some cases, we are using toxins prepared or secreted by the microbe, like tetanus. They are liberating toxins. It may be inside the cells or it may be outside of the cells. That toxin we are using as a antigen and preparing the vaccines. These are the tetanus toxoid or DT vaccines, diphtheria tetanus vaccines. Then polysaccharides and polypeptides. Polysaccharides and polypeptides. Instead of taking entire microbes, we are taking certain part of the microbes. Certain part of the microbes. For example, meningococcal vaccines. It is prepared from the meningococcal uh, bacteria's their cell wall is used, whereas hepatitis B vaccine we are preparing from the capsule of hepatitis B virus. So capsule means outer side covering is there on cell wall, like how we are dressing to our skin, that become as a capsule like structure. From that we are making the vaccine. And last, a surface antigen vaccination there. It is prepared by the microbes cloning. Cloning means taking up some part of that and in artificially we are making a similar microbes in laboratories. For example, hepatitis B surface antigen, this is a cloning type of structure. Generally, you might have heard a cloning of human. It is legally banned, but we are taking some cells of the body of human and we are making artificial human body in laboratory. That is called as cloning. So these are the different type of vaccines are there and their examples are there. But their use of prevention of the disease, it is the same. How they are prepared, how the status depends upon that. These types are there. So when we are taking the vaccine, how we are getting the immunity power? How we are getting the immunity power? Mainly there are three important phases are there. First, in the form of microbes enters in our body or vaccination enters in our body. Second, these antigens or microbes, they stimulate to our immune system and our immune system prepares antibodies in our body. And third, these antibodies remains for long time. Whenever such type of the microbes enters in our body, they will identify and they will destroy the same type of microbes, and the antibodies are remaining for long time. Certain antibodies, they will reduce their potency in certain durations, so we are taking repeated vaccination of that. So So vaccine or infection enters in our body, immunity system start producing the antibodies against of that. These antibodies they kill the present microbes as well as the antibodies remains in our body. Whenever the microbes enters in our body, they will destroy. So our body is ready for that. Take simple example of our military. So the military, our military is like antibodies are there, foreign enemies are there, these are the antigens are there. So anytime these enemies may attack to our nation, our body. So our body, military is there, these are the antibodies. They are ready every time to fight against antigens. Then there are two important concepts are there. Some vaccines why we have to take multiple times, like 1, 2 doses are there or booster doses. Some of the vaccines we are taking once. So multiple doses, one or more dose does not one dose does not create sufficient immunity or does not last long enough. That's why its doses may be 1, 2, 3, or it may be booster doses are there, or after certain duration repeatedly they have to take. Second, booster doses. So when you are giving again and again similar dose, that is called as booster dose, just to stimulate whatever the immunity power was there, to make awareness or to more effective. For that purpose, booster dose is important. Then overall the world expanded immunization programs they are implemented as advised by the WHO World Health Organization in 1974. So every child and pregnant woman. That's why it is called as expanded program. What vaccines are given? In that vaccines we are giving tuberculosis, BCG vaccine, poliomyelitis, polio vaccine, diphtheria, pertussis, tetanus, DPT vaccine, hepatitis B vaccines for hepatitis D disease, measles, mumps, and rubella. MMR vaccines are given separate measles vaccines along with vitamin A vaccines. So tetanus toxoid vaccine is given to the mother. Why you are giving these vaccines? To reduce incidence of target diseases in mother and child. To reduce incidence of the diseases, because even one disease can create other diseases by reducing our immunity power. So various countries they having a specific immunization schedule is there. I have taken example of the India. WHO also gives guidelines. It is not totally different. Few vaccines might be different. So these vaccines, it is given to the mother, it is given to the infant, it is given to the child, especially. And there are some other specific vaccines are there, other age groups like adolescents, adult, old age members. There are some specific vaccines are recommended in specific situations are there, specific decisions are there, specific conditions are there. Like it may be epidemics or it may be pandemics like corona. One by one we'll see. First, vaccination given to the pregnant woman. So what vaccines are given? Tetanus toxoid vaccines are given. 2 doses are there. Early pregnancies, immediate confirmation of the first. This is a 0.5 ml intramuscular is given, and second dose after 4 weeks or 2 months later on. So it creates antibodies in mother's body, and through the placenta these antibodies goes to the baby. So a newborn will not get neonatal tetanus. Newborn will not get neonatal tetanus. Also mother also prevent tetanus disease. This is a somewhat big list. In short, I will tell you certain vaccines and which disease is prevented. So BCG vaccines at birth we are giving a dose is very small, zero point 0.1 ml is given to prevent tuberculosis. A special mark is there, intradermal it is given on the left upper arm overall the word. Hepatitis B dose, these are given in 3 doses are there at birth and after 1 month, 6 months is given. It is given intramuscular. Second, oral polio vaccine. There are numbers are like 0, 1, 2, 3. Because for EPI programs, the zero dose was not there, so they are given one dose, two dose, three dose, and towards it is started, so that's why the name is given 0, 1, 2, 3. As well as in case of pulse polio vaccination, we are giving additional dose at a time to particular areas, overall state or country. The rotavirus to prevent the diarrhea, but it is not a routine vaccine as an immunization schedule. There are some injectable polio vaccines are there. In some cases where injectable viruses are there, Salk type of virus available in that cases are there. Then pentavalent means five vaccines are given. These five vaccines are there. Letter title is there. So basic, whatever the basics are there, like BCG, hepatitis, DPT, and hepatitis B. Penta means 5. Measles also included in that. It is given at the 9 to 12 months of age. It is given 0.5 ml subcutaneous. Along with that, vitamin A dose is given because it helps to increase the efficiency of measles vaccines, and vitamin A protects blindness of the children. So this is for the infant 0 to 1 year. Next, children, somewhat similar vaccines they are giving repeatedly. DPT vaccines, it is a booster dose is given, same route it is there. Measles vaccines, if it is needed, booster dose is given. Oral polio vaccine, 1.5 years and 4.5 years second booster will there. Vitamin A doses, there are total 5 doses are there. After each 6 months, from 9 to 12 month first dose, it was a one dose of 1 ml, 1 lakh unit. Afterwards, 2 lakh in international units are there. And tetanus toxoid is given 10 to 16 years in case of history of infection. Then vaccination to the various special occupations, very important. That's why vaccination is needed to each and everyone, not only children, not only adolescents, adults, pregnant women, old age members, and all these special members. In short, each and every members. For example, healthcare workers, they need to take hepatitis B, influenza, MMR, mumps, measles, and rubella and polio vaccines. Public safety personnel like police or firefighters and staff of the institutions, they have to take hepatitis B vaccination, influenza vaccinations. Veterinary members or animal handler members, they have to take rabies vaccines. It is mainly created from the animal to the human being. Plague, anthrax type of disease. Sewage workers, especially the waste, human waste, they are disposing or treatment is taken. They have to take diphtheria and tetanus vaccine, hepatitis A vaccine, polio vaccine, typhoid A and B. Food handlers, they have to take TABC, typhoid A and B along with cholera. Military members, they have to take pneumococcal infections and influenza, BCG if it is not reactive after testing is there, and tetanus. Some other special members are there in a particular situations, like homosexual members are there, heterosexuals are there, those are multiple partners are there exposing to the wrong practices of the sexual, it leads sexual transmitted diseases, or drug takings are there, drug abusers are there, or their close one family members are there, they have to take hepatitis B vaccines. Next is certain health problems are there. The situation like immunocompromised persons. Immunocompromised means our immunity power is very less. For example, certain cancers like leukemia, blood cancers, lymphoma, WBC cancers, HIV, AIDS, malignancy, other cancers are there. Hemodialysis, when kidney is functioning not proper, in that cases we are taking blood out and purifying it. That process called as hemodialysis, or transplantation of certain organs when work organs are not working well. It may be liver, it may be various skin parts are there, or other parts. Should receive the vaccines like hepatitis B vaccine, influenza vaccines, pneumococcal vaccines. They have to take. Next, travelers. Those are traveling from particular one state to the other state, especially from one country to another country. There is international rules are there. They have to take certain vaccines. Then and then they will allow to enter or go out in particular countries. What are the specially? That is a typhoid A and B, yellow fever, cholera, meningococcus, pneumococcus, hepatitis B, influenza, rabies, plague, Japanese encephalitis are there. So depends on the particular areas, they are advised specific vaccines are there. So certain diseases are there, situations are there, behavioral pattern of particular members are there, and professional members are there, travelers are there. They have to take. So we have taken consideration vaccination to the pregnant woman, infant, under 5 members, adolescents, adults, old age members, as well as special members are there. So the adolescents, this is also very important group because they are active in work as well as sexually active are there. They are exposed certain bad habits like taking of the drugs or bad habits like smoking, alcohol, other things are there. So through that the infection may occur. So they have to take certain vaccines according to the advice and clinical observations are there. These are the common same vaccines are there in particular situations. They have to take, for example, hepatitis B, MMR, tetanus, influenza, pneumococcal disease, diphtheria, chickenpox, measles. Presently, maybe corona in particular situation if it is in there. That is advised, especially MMR is advised in the adolescents in various country. Second, adult members are there because these are productive members as well as these are the reproductive members are there. Prevention of disease, it is important because they will take care of the family members. They are productive members are there. These are the pillars of the nations. The vaccines they are advised according to their situation, according to the profession, according to their health status. So many type of vaccines are available. Find out the immunity power and based on the need or immunity power, certain vaccines are given to the adults and according to their situations. Next is the old age members. These are needed because their immunity power is low. Like in a childhood, the immunity power is not developed, whereas in old age it is decreased immunity power. They are prone for various infectious diseases. If one it is occur, it may cause other. If this type of disease occurs, it may lead other non-communicable disease also because of prolonged infectious irritations. So these are the common available vaccines are there to all the members according to the age and difference. Very important to the pregnant women, infants, children, adolescents. Specific health professional members are there. In risky area members, vulnerable groups, those are staying in the slum areas, refugee members are there. So nowadays the new vaccines are available or they are available in various forms which is safer, effective for long time. For example, typhoid vaccine is available along with cholera, that is called as TABC vaccine. Malaria, overall the world, the malaria is first ranking communicable disease. So this is caused by the malaria parasites transmitted through the mosquitoes. So the vaccine they will prevent such type of the malaria. Again, there are various strains are there. Third is a dengue fever. Dengue fever, chikungunya, malaria, these are the mosquito-borne diseases are there and they are affecting especially the adolescent children and the effect is remaining very long time. They are become as a morbid persons or handicapped persons or the death rate is very high. Then HIV vaccine. Nowadays the number of cases are comparatively very less, but still it is having a great affinity to tuberculosis. So tuberculosis can cause HIV vaccine, HIV infection, or HIV infection can cause tuberculosis because of reducing immunity power, and other diseases also can occur. So you have to motivate and take the consultations for typhoid A and B according to situations, immunity power, malaria vaccine, dengue vaccines, chikungunya vaccines, Japanese encephalitis, and HIV virus or human papilloma virus. There is a vaccine also available for the leprosy and for cancer, especially cervical cancers, that is a human papilloma virus vaccine is available. Nowadays, some vaccines are available in the edible form. You can get some products through that you are getting the vaccines, and there are certain devices are there. In a simple ways, they are giving instead of the injectable, they will give the oral, or it may be spray, or just apply to the skins. So every individual, they have to aware about what is going on, what are the new vaccines are there, how it is advantageous to everyone that has to use it, share it. That is very important. A simple information may save many lives, many lives. Simple protection along with taking the vaccination. Most of the vaccinations, they are free, easily available, and provided everywhere. Next, what care you have to take before vaccination, during vaccination, and after vaccinations. So many list, so much list is there. So here generally we are considering the vaccination, especially for the children, but most of the same points you can apply to the adults, old age member, or other group of members are there. So before vaccination, explain to the parent or older children, or if it is adult, you have to explain what type of vaccine is given, why it is given, what are the minor side effects are there, complaints are there. Then remain calm and confidence while taking the vaccination. Bring a favorite things or make a favorable and conducive environment for the adults. Avoid the pain relievers after vaccination, immediate after vaccinations. So during the vaccinations, proper position, proper process, aseptic technique is there, and distraction to the painful response, that is important. That distraction may be conducive environment, maybe the uh, listening or having certain type of the movies are there, or having a good chat. For small children's breastfeeding, it act as a diversion, it act as a pain relieving measures. After vaccination, the members has to stay in the particular area to observe certain immediate reactions will be there. There might be some immediate reactions, but it will subside very soon. Are they having certain common treatment measures are available? Encourage to each and every members to start their activities after vaccination, which normally we are performing. So offer the liquids, so it will be improve your hydration process. You will be looking fresh. For pain or fever, specific treatment is given. It is a minor form. So fever may occur afterward. It is a process, a reaction to the process of preparing the antibodies. Preparing antibodies. They pay especially extra attention to the small children, especially below 1 years are there, or when you are giving immunoglobulins or serums, you have to take special attention because these are very sensitive, especially live vaccines. They can cause certain reactions. Very important, do not squeeze, crush, rub, oil, massage, application of any ice and other things should not be given to the injectable site. Do not apply ointment, also oils or herbs. Do not put any plaster or any other things on injectable area. So before, during and after, the care of vaccination is also equally important. This is a one small picture form is there. Even it is regarding the COVID vaccine, but it is somewhat similar to all the vaccines. Considering their age, considering their roots, you have to take care. What are the safety precautions are taken for various vaccinations? Take the history of any reaction to the previous vaccination or find out the contraindication for particular vaccine. Follow the various R's are there. This is the right patient, right dose, right vaccine, right route, right potency, right time. Then frequency also. First, second, third, fourth. This is the observe the aseptic technique because we are giving only specific microbes to the person. It should not be super added other microbes during the process of vaccination. Take vaccines at the right time and the situation, especially some extra vaccines they are advised in a particular situation, maybe epidemic, it is advised. Then keep ready the treatment for the expected side effects at the site of at the place where the vaccination is given. Cold chain, cold chain, not a gold chain. Cold temperature chain, why it is called? Because vaccine it is prepared in the industries, then it is transported to the various settings of big storage system, then the big hospitals, then to the state level, from the nation, from the state to the district, district to the PSC, PSC to the sub centers. So it takes certain duration to get from the industry to the beneficiary. In that whole process, the temperature of the vaccine is important. That should maintain as desired vaccine temperature at each and every area. Then and then vaccine will act as antigen and produce antibodies. Otherwise, there is no use of just giving the thing. So equally important, maintain the temperature of the vaccine. That whole chain is called as cold chain of the vaccine. So maintain desired temperature of the vaccines from production till beneficiary. Needed to maintain the potency of the vaccine. Why? Because vaccine, the microbes should remain active to create the immunity power or antigens. Check the functioning of the vaccine storage devices. So vaccine storage devices, their function is important because it is run with certain energy, especially light is there, or the device functioning is important because whatever the indicators are the response we are getting, it should be proper. Recorded report the observation of vaccines temperature daily as it is advised. This is a pictorial form is there from the industry. It will be sent, it will send to the storage places, then to the hospitals, hospital to the district level, to the sub-center levels are there, and it be given at the sub-centers or specific vaccination camps are there to that. The whole process, we are maintaining the temperature of the vaccines, so it will be having potency or its activeness important. Some devices also use in the local areas. They may be freeze, they may vaccine carriers are there, and to maintain the temperature, there are the certain boxes are there. That is called as ice boxes are there. VVM again related to the cold chain and vaccine. What is the full form of that? It is a vaccine vial monitoring. So this is the indicator is there. It says that the vaccine is useful or not useful. So there are certain indicators are there. According to the vaccines, the different indicators are there and its meaning is given. For example, here the two parts are there. One is a dark part and square is there. So if the dark part and square is visible, then you can give the vaccine. In first two cases, if there is this appear of the square, we should not give it, and both is disappears, we cannot give the vaccine. It is more clear about this. first stage, second stage. Both should be clear visible, or at least middle part should be clear visible. But if both are invisible or outer part is not visible properly and inner side becomes dark, that vaccine should not be used because it is lost its immunity formation ability that is called as potency. So vaccination still overall what the numbers are much more, but it has to take in a proper way to get its benefits. Benefits. And new vaccines are coming up, so we have to remove certain wrong concepts of the vaccines. These are the few wrong concepts are there that is called as myths and what is actual facts. So what is the first myth? Vaccine contains harmful ingredients. No, it is contain antigens, weakened power is there and preservatives are there. So just to maintain the potency, it will not cause any harmful reactions or diseases. Second myth is vaccines can cause autism or sudden death is there. It is the rarest rare case, 1 in 10, 10 years, 20 years or more than that cases. It happens. It is better to have a disease than to become immune through the vaccines. Very wrong concept is that because in vaccination we are using a very small dose, its cost is very less, but when you are causing disease, it is harmful to the body, it may cause serious complications or even death or for the treatment. The cost of the disease is very high. Next, I didn't need to vaccine to my child because all other children around them are already immune. This is also myth because even single members, if it is infected, it may spread disease to other members when the other members immunity power goes low, especially some diseases may spread fast like endemic, pandemic. Epidemic means large in a particular area, pandemic overall the world. Next myth is a child can get disease from a vaccine. It is unlike 1 in 10 lakhs of it. That's even after vaccination we may get disease. This is possible in rarest rare case if vaccine is given at the same time there will be disease considering areas are there, so along with the vaccine they are getting the microbes from the particular area and the disease will occur, but it will be considered as because of vaccine we got the disease. The effectiveness of vaccination is never been proven. It is false because it is proven in the scientific ways and also getting the body response. Many disease members they are prevented disease or eradicate smallpox. No one in the world is there. We are trying the eradication of the polio also. Vaccines are preventing only infectious diseases. No, nowadays some non-communicable diseases like cancers also we are trying to uh, prevent it as leprosy, diabetes, hypertension. This research studies are going on. There are some very minor and rare side effects are there, but it has to report or it has to inform to the vaccine receiver members. The reactions may be local or overall the body. Local pain, swelling, redness, tenderness, and generally it may be fever, malaise, and headache. Very rarest rare case there will be sensitivity. What is the treatment for that? Assess the case before the vaccination. Explain a few and minor side effects of each and every vaccine. Those are received by the members. Do the sensitivity test, especially for the antibodies and serum or live vaccines. May provide symptomatic treatment immediately. Keep ready the emergency measures to manage the sensitive reaction. Keep the follow. Contraindications means in which cases we are not giving the vaccines, especially when there is immunity power is low in particular disease, certain vaccines we are not giving, like cancers are there, blood cancers are there, or certain steroid drugs are there, so they are suppressing the our immunity power. Certain killed vaccines, if there is hypersensitivity, we are not giving it. So even the vaccines, the small dose is there, preventing so many diseases, communicable, non-communicable, overall the world, all the age group members, specific situations are there. That's why the title is there: vaccination, small dose, big protection. But even it is protective, but there are certain challenges are there. But these are minor challenges are there. When the combined efforts are taken, the challenges will be subside. Accessibility, getting up certain vaccination. Some vaccines, they are, all the vaccines are not free, they are not affordable, but there are certain alternative measures are taken. Quality of the health services at the peripheral level. Political and social neglects in some cases of the crisis situations. Vaccine hesitancy is there. Particular vaccines depends upon their knowledge, depends upon their beliefs. Vaccine manufacturing capacities, because certain industries, mainly they are in the developed countries, but underdeveloped and poor countries, compared to they are less. Maintain the cold chain is important and mix. These are the challenges, but there is solution. Where there is problem, there is a solution. Make the awareness very important measure about the vaccines. So many vaccines are there, prevent the diseases in place form, wherever available. Take involvement of the people. Every member should come forwards. Take the help of the mass media, especially mass medias like TV, mobile, computers, fast they are sharing to print medias and this e-medias. Outreach activity, go to the individual place and give the vaccination instead of they have to come to hospital setting. Survey and identify, motivate the vaccination and give the follow-ups. Take help of various voluntary health organizations, WHO, UNICEF, and other things. Achieve the UCI, Universal Child Immunizations, or you can say as every individual state should get the vaccination according to the situation and their need. Future, again, it will make our lives easy because of making new vaccines, new forms, new methods are there. In future, there will be needle-free vaccines will be available. Like it may be oral, it may be skin applications, or it may be nasal sprays are there. No restriction of the cold chain because it is a major problem. But in future, it may occur. They will provide in the dry forms and new devices or new vaccines will be provided which do not need temperatures. Combined vaccines like Pentavac, I told. So instead of coming one time for one vaccines, get the vaccines 5 6 at a time. So frequency and disease prevention will be more. Vaccines specially available for endemic, pandemic, and epidemic to prevention and control. Vaccines for non-communicable diseases like cancer, diabetes, hypertension, asthma, arthritis. Vaccination will be available at the doorstep. Countrywide or worldwide, same vaccination for same day. For why? Because for the eradication of certain diseases. If this process occurs, the whole world will get immunity that is called as herd immunity. HERD, herd immunity. Once herd immunity is developed over the world, the vaccine or the disease will disappear. Cloning of the vaccines, taking some part of the microbes, and we are preparing the vaccine in the laboratories in larger and safe form. In summary, we have discussed what is a vaccination. Vaccination given to the various age group members, various situation members, and lot of vaccines are available. Vaccinations also we are making aware of them. What are the process of giving, taking care of there? What are the side effects? Are how to prevent it? To whom it is not given? How to solve the challenges and what is available in the future vaccines are there. In conclusion, I would like to say vaccines, they are safe, effective, and life saving. Vaccines are safe, effective, and life saving. These are some references taken from the WHO, ICMR, UNICEF. Some disease controlling agencies are there, or Wikipedia is also there. So thank you each and every member those are listening. Special thanks to the organizers because they are providing the stage to me to interact to all these members over all the world. And I must say thanks from the bottom of the heart to the vaccines. Because of them, I become healthy. So many members are becoming healthy. Thank you once again, one and all. These are the listed various diseases when it is identified there. Thank you, ma'am.
Thank you so much, sir, for each content presentation which can impact our knowledge seeker sharing. After your presentation, I hope our knowledge seeker can learn something new which also our new intention. Learn and grow together, IGP knowledge seeker. Once again, thank you so much, sir, for your presentation. Now, sir, it's time for a question and answer session, which is the one more valuable part of our regular webinar. Honorable sir, this is Kavita. After a short video, we will back in our session part 2, which is the question and answer part. Dear IGP knowledge seeker, please ask your question in the comment box as much as you want to know from our speaker. Thank
Yes.
you. After question and answer, we have a webinar certification and online quiz competition. Dear IGP knowledge
Part
seeker, please ask your question in the comment box as much as you want to know from our speaker. Thank you. After question and answer, we have a webinar certification and online quiz competition. Welcome back, sir. Welcome back to our participant. GP knowledge seeker, please ask your question in the comment box as much as you want to know from our speaker. Thank you. After question and answer, we have a webinar certification and online quiz competition. They are IGP knowledge seeker. Please ask your question in the comment box as much as you want to know from our speaker. Thank you. After question and answer, we have a webinar certification and online quiz competition. So our first question is from Kingway. How many types of vaccination do we have, and what are these types of vaccinations?
Okay, thank you for participant to give opportunity to discuss with you. How many types of vaccinations are there? As I mentioned here, there are mainly 5 types of the vaccinations. First is a live vaccines are there, then there are toxoids are there, then there are some serums are there, immunoglobulin type of the vaccines are there. Killed vaccines are there. These are mainly 5 types of vaccines are there. Most important, live vaccine and killed vaccines for prevent the diseases when disease occurs. Then antibodies and serums are given. I
Thank you
hope.
so much, sir, for your answer. So there is no more questions from our participants. So once again, thank you so much, sir, for your time in ITP. We have learned a lot from you with freedom. It will add some value to our day-to-day activity along with our academic and professional growth. Honorable sir, hope to see you again with a new topic and a new date. Thank you, sir. Take care.
Thank you, ma'am. Thank you for your support and making the stage conducive environment for interacting with all these members.
Honorable sir, before we move to the next, if you are looking for something, you can.
Thank you, ma'am.
Dear IGP knowledge section for the webinar certification. This is the most attractive and powerful part of our regular webinar. After a short video, we will start our webinar certification. After webinar certification, we have an online quiz competition and quiz certification. Dear IGP knowledge section for the webinar certification. This is the most attractive and powerful part of our regular webinar. After a short video, we will start our webinar certification. Certification process. Visit www.radioigp.com. Please make sure your presence on our website. Find a running session and get enrolled. After watching completing part 1, move to the next line test passing negative person. Pass back to the course again to download the certificate. If you take the course, download the certificate in PDF or JPG. For your attention, I'm going to share the procedure again. Visit www.radioigp.com. Please make sure your presence on our website. Final learning session will get ended. After watching complete part 1, move to the next to the learning test passing negative person. Pass back to the course again to download the certificate if you retake the course. Download the certificate in PDF or JPG. We are IGP also gets the most engaging part of this webinar, which is an online quiz competition, which is our regular webinar activity. We change the few quizzes for online quiz competition so that after like no one can participate. Now, time for the online quiz competition. To join the online quiz competition properly, please follow my instruction carefully. Now, time for the online quiz competition. To join the online quiz competition properly, please follow my instruction carefully. Visit www.edurgp.com and sign up or sign in. Without this, you cannot join live quiz competition anymore. Browse the live quiz button given link. Find the session and join with the log website or user account. Click join and wait for a few minutes for others to join and join on a live quiz competition. After the quiz, we will issue certificate for top 10 as previously, which you can find on our official Facebook page and Google Ministry of Global Professional. After a short video, we will start our quiz session. With 17 people, we are going to start our quiz session right now. First question is, this is a vaccination available for, there is a vaccination available for smallpox. Is it true or false? Option 1 is the right answer. 64% people are right. Our second question is, how are general smallpox pregnancy involved? Is it option 1 or option 2? Option 2 is the right answer. 7% people are right here. Our third question is, vaccination are successfully used to dash smallpox. Is it option 1 or option 2? Option 2 is the right answer. 87% people are right. Our next question is, vaccinations are only effective for small children. Is it true or false? Option B is the right answer. 100% people are right. Our next question is, Alexander Fleming discovered vaccination for smallpox. Is it true or false? Ashwin, with the right answer, 71% people are right. Our next question is, when was the smallpox vaccine formed? Is it option one or option two? Ashwin, with the right answer, 79% people are right. Our next question is, which virus is used in a smallpox vaccination? Is it option one or option two? Question is right answer, 28% people are right. Our next question is, how many smallpox vaccination do children get? Is it option one or option two? Option one is the right answer. 8% people are right. Our second last question of the session is, when is the vaccination for smallpox created? Is it option one or option two? Option one is the right answer. 15% people are right. Our last and final question of the session is, when did they invent a smallpox vaccination? Is it option one or option two? Option B is the right answer. 20% people are right here. Congratulations to our online quiz competition winner, top 10. Congratulations, Silent. We will take a few minutes for final result. After that, we will issue our online quiz competition certificate and official certificate from the state of local professional. Congratulations to our online quiz competition winner, top 10. Congratulations, Silent. We will take a few minutes for final result. After that, we will issue our online quiz competition certificate on official certification from the state of local professional. Congratulations to our online quiz competition winner, top 10. Congratulations, Adam. We will take a few minutes to final the result. After that, we will issue our online school certificate and official certification to the state of global professional. At the end of the session, we can say properly details the best of planning, cost, life, members, teaching us. We have to say, see you again and again. We want your participation in every program. If you want to live a happy life, that way, go not a people of things, Albert Einstein. This question we can learn better. I can also thank all IGC knowledge seekers for active participation and others. See you again in the next session. Thank you.